Cataract. Cataract is the commonest cause of blindness in the world. Total of 17 million sufferers, and till now, the only cure is being an operation. Later we have non-surgical treatment of cataract. Overview. Cataract is a clouding of the eye lens, the part of the eye responsible for focusing light and producing clear, sharp images. The lens is made up mainly of water and protein. Over time, protein can build up, clouding the light passing through the eye and making slight blurred or fuzzy. The most people, cataracts are a natural result of aging. Often cataracts develop in both eyes at the same time. The symptoms vary but include gradual blurring of vision, halos around lights, glare and double vision. The worst cataracts, where the iris appears almost clouded over, can cause a total loss of vision. Symptoms and signs. Not all cataracts damage vision or affect daily living. For those that do, common symptoms include cloudy, fuzzy, foggy or filmy vision, glare from lamps or the sun, which may be severe, difficulty driving at night because of glare from headlights, frequent changes in eyeglass prescription, double vision, difficulty performing daily activities because of vision problems. Parents need to watch for signs of cataracts in infants and children. Causes of cataracts. There is no single cause of cataracts, the clouding of the eye lens. A number of risk factors have an impact. There are some risks that can be reduced by change in lifestyle, and some that can't. Sightsavers is raising awareness of the risk and providing treatment where possible. Risk that can be reduced. Cigarette smoking, drugs. Some eye drops used to treat eye problems contain steroids. If unsupervised and taken over a long time, they can cause cataracts. Diabetes. Proper treatment can lessen the risk of cataract. Dehydration. People who have suffered severe dehydration seem more likely to suffer from cataract. This can result from severe illness such as cholera, chronic heat stroke, or even from local customs such as withholding water from women during labor and immediately after giving birth. At old age, the elderly experience dryness and an irritating sensation in the eye. Is this normal to old age? In old age, there is a reduction in the secretion of tears which play an important role in the protection of the eyes. Each time we blink, eyelids wash the eye with the tears secreted. Tears act as lubricant and keep the eyes clean and moist. To prevent drying, one should often wash the eyes with clean cold water. Pediatric cataract. Congenital cataract. Congenital. Simple means present at birth. So a congenital cataract is a cataract that a baby is born with. Somewhere between 500 and 1500 babies are born with congenital cataract each year in developing countries. Somewhere around 3 babies in 10,000. Rates in developing nations may be higher. My child has a cataract. Would he be able to see? It is very important to treat this condition as soon as possible to get the best results. Most children who are treated for cataract at the right time end up seeing well, though there might be certain conditions in which the vision is low even with the best possible treatment. Why is it important to treat childhood cataract early? The presence of cataract in a child does not let the eye get proper visual stimulus to develop. This prevents the normal development of the eye, especially if the cataract is present in only one eye. This condition is known as amblyopia or lazy eye. Therefore, it is important to treat this condition at the earliest to prevent and to treat amblyopia. What are the methods of treatment for childhood cataract? The treatment options are cataract removal without intraocular lens implant, cataract removal with intraocular lens implant. The procedure. Cataract surgery today is typically performed using a microincisional procedure. To the patient, this means minimal discomfort during or after surgery, a more speedy recovery of vision, and reduced risk of induced astigmatism. This means a less dependence on glasses afterwards. Below we've detailed the major steps of cataract surgery using a microincision procedure, phacoemulsification, ultrasonic cataract removal, and a foldable lens implant. This type of procedure is considered state-of-the-art for cataract surgery today. The procedure demonstrates basic principles only. However, and the eye surgeons use many variations of the general theme, even from one case to another, depending on the type of cataract being removed. The most commonly used cataract incision is about 3 mm in size, just about 1/8 of an inch. Because of the careful construction of this incision and its small size, the incision is generally self-sealing. They translated to a no-stitch type operation. The surgeon then creates an opening in the capsule, which is microthin membrane surrounding the cataract. This procedure, called capsulorhexis, needs extraordinary precision since the capsule is only about 4,000th of a millimeter thick. This membrane is thinner than a red blood cell, and the surgeon must delicately remove the capsule while manipulating instruments within the anterior chamber, a space only 3 mm deep. Phacoemulsification is the aspect of the procedure in which ultrasonic vibrations are used to break the cataract into smaller fragments. These fragments are then aspirated from the eye using the same instrumentation. The surgeon may elect to create grooves in the cataract. They subsequently break the cataract into smaller pieces using the phacoemulsification tip and a second instrument passed through a smaller side port incision. The lateral view of the procedure shows the cataract by the eye surgeon. The phaco aspect of the procedure is used to remove the denser central nucleus of the cataract has been removed. The softer peripheral cortex of the cataract is removed using an irrigation aspiration handpiece. The posterior or backside of the lens capsule is left intact to help support the intraocular lens IOL implant. The intraocular lens is often folded and passed through the tiny incision, where it is opened implanted inside the capsular bag. In this illustration, the lens is being inserted via an injector. This is an instrument designed to help keep the incision size small while allowing implantation of a 6 mm lens through a 3 mm or even smaller incision. The IOL is shown here implanted within the capsular bag, where it is neatly centered. The springly arms of the IOL, known as haptics, hold the lens implant within the capsular bag. The IOL does not generally require structure to remain in good position. This lateral view of the IOL implant shows the lens within the capsular bag, which is desired location. This location is the same as that of the natural lens. This position is the same as that the natural lens cataract of the eye and therefore is generally tolerated best and provides the most optimal visual results. At this stage, the cataract operation with IOL implantation is complete.